Hello everyone, my name is Sam. I'm a GP. Today I'm going to briefly discuss about the diagnostic criteria for adult ADHD. Before I begin, I just want to show my disclaimer. The video content is not intended to be a substitute for professional medical advice, diagnosis, or treatment. It is purely for educational purposes only. So to diagnose adult ADHD, we usually use something called the DSM-5 diagnostic criteria for adult ADHD. So DSM stands for the Diagnostic and Statistical Manual of Mental Disorders. It is the 5th edition, therefore it is called the DSM-5. So the first group of symptoms for the diagnosis is the symptoms of attention. We need 5 or more of them. The second group of symptoms are the symptoms of hyperactivity and impulsivity. We also need 5 or more of them. And these two groups of symptoms must have persisted equal to or more than 6 months, to a degree that is inconsistent with the developmental level and negatively impacts on the social, academic, and occupational activities of the patient. We will now go into more details about the symptoms of inattention. There are 9 of them. We only need 5 or more. We need 5 or more. The first one is very obvious. Is a patient has difficulty in sustaining attention, therefore the word inattention. Number 2 is easy distractibility. I think they are quite related if you think about it. You cannot pay attention, therefore you're easily distracted. And number 3, the person doesn't seem to be listening when spoken directly to. This is obviously related to difficulty paying attention too. So they are all related. And number 4, because of criteria number 1 and number 2, the patient has symptoms number 4 as well, which is that he or she doesn't like and try to avoid tasks requiring sustained mental effort. And number 5 is also quite related. Is that even the patient is involved in tasks that require sustained mental effort, he or she fails to follow through on the task or instructions. So they are all quite related. And additionally, the patient also has got number 6, poor organization skill. Number 7 is forgetful in daily activities. And because of 6 and 7, the patient manifests symptoms 8 and 9. Number 8 is that he or she makes careless mistakes and lacks attention to detail. And number 9, the patient loses things unnecessarily for task and activity. So these are the symptoms of inattention. We need 5 or more of them. The next group of symptoms are the symptoms of hyperactivity or impulsivity. We also need 5 or more of them to qualify. The first one is a feeling of restlessness. And the second one is the patient fidgets with or taps hands or feet and squirms in seats. Number 3, the patient leaves seats in situations when he or she is expected to be seated. Number 4, the patient is always on the go or as if driven by a motor, non-stop, always non-stop. Number 5, the patient talks excessively. Number 6, the patient has difficulty engaging in quiet or leisurely activities. Number 7, the patient seems to be always interrupting or intruding on others. Number 8, the patient has difficulty waiting for his or her turn. Finally, number 9, the patient blurts out answers even the questions is not directed to them. So these are the 9 symptoms of hyperactivity or impulsivity. You also need 5 or more of them to qualify too. So additionally, several of these symptoms, of these 2 groups of symptoms, must be present before the age of 12 years old. And these symptoms must be present in 2 or more different settings. For example, at home, at school, at work, talking with friends or relatives, or in other activities. And there is an obvious evidence that these symptoms affect, interfere, or reduce the quality of their functioning socially, academically, or occupationally. And finally, These symptoms must not be caused by other causes. And these causes must be excluded to diagnose someone with adult ADHD. Condition that must be excluded include schizophrenia or another psychotic disorder, mental health disorders such as mood disorder, anxiety, dissociative disorder, or personality disorder, or the use of substances that leads to intoxication or withdrawal symptoms. So these three different group of disorder must be excluded before we can diagnose someone with adult ADHD based on the 5 or more symptoms of inattention, 5 or more symptoms of hyperactivity or impulsivity that last more than equal or more than 6 months in 2 or more different settings that affects their quality of life. I hope this helps to clarify the symptoms of adult ADHD. Thank you very much for watching my video. If you like my video, please kindly subscribe. Thank you very much. Please stay alive, stay safe, and stay healthy. Well wishes. Thank you. Bye-bye.